The largest group of doctors officially recognizing racism as a public health threat as the pandemic highlights the drastic health disparities in Black and brown communities.
Lisa Evers shows us how the new policy by the American Medical Association could be a big step toward bridging the gap in care.
Like many communities of color, this Mott Haven neighborhood in the South Bronx has been hard hit by the COVID-19 pandemic. Now one of the country's most prestigious medical organizations is taking steps to address this disparity by declaring racism a public health threat. The American Medical Association, or AMA, has announced a policy that recognizes racism as a key factor of health. It's an official acknowledgement of conditions long experienced in communities of color, says Dr. Charles Thompson III.
It's very significant, Lisa. We all have known in the medical community and in community in general that race plays a large part in every aspect of our life, particularly the health of minority population.
The CDC says nationally, blacks are nearly 5 times more likely to require hospitalization for COVID-19 as whites and are dying from the coronavirus at twice the rate. The Hispanic population is also disproportionately hurt, says New York State Assembly member Karina Reyes, who continues to work as a registered nurse on the pandemic's front lines.
Actually, COVID-19 has made it even more glaring that there are these huge disparities within communities of color.
Karina Reyes says adverse health issues like diabetes, obesity complications, and other pre-existing conditions resulting from lack of access to quality health care made communities of color especially vulnerable to COVID-19.
You know, when you're in the hospital on the front lines and you see the amount of deaths, I mean, when we're talking about refrigerated trucks to hold the bodies of the people of our community that have succumbed to this, you can't help but question, why is it?
The AMA describes 3 tiers of racism: systemic, cultural, and interpersonal. Change has to start with training, says Dr. Charles Thompson III.
Most of the time is very unconscious, but by bringing it now to the forefront, it should be more on the top of mind of most healthcare practitioners that this unconscious bias or unconscious racism does exist.
Assemblymember Reyes predicts that the next challenge will be to convince communities of color, historically skeptical and disengaged from the medical establishment, that a COVID-19 vaccine could just save their lives. In the South Bronx, I'm Lisa Evers.